Hi, I'm Dr. Ashish Philip and I work at Aster Hospital here at Bangalore. Many of you have heard the word arthritis, and I know the information about it is everywhere, but have you truly understood what arthritis is? In this video, I just really like to try and make it relatable so you understand the basic problem of what arthritis is. Now, our bones in our joint serve as a point of movement, right? So with any part that moves, there's always something called friction. Now, if we have to make it relatable with something which we use every day, if you take a wheel of a car, they both are very similar. Now, the wheel is made out of two parts. One is the rim, the metal, and a tire which covers the rim. Now, the reason why you have the tire is to reduce the friction, right? You can run your car on the rim, but it wouldn't be very comfortable. So we add the tire. The same way, if we take our bones, right, where the joint is, you will find that the bone is covered by something called cartilage. And this cartilage reduces the friction, number one. And number two, it also prevents you from perceiving pain, right? But your underlying bone can perceive pain. So that is why in arthritis, when the cartilage starts to wear out, just like a tire which starts to wear out on your car, you start having pain, right? Now, every tire which is there has a set mileage on it, maybe 50,000 kilometers before you have to change that tire. Similarly, most of our cartilage lasts up to 60 to 70 years, and after that, we start perceiving pain, right? And that's when we have to start thinking about changing that joint. But that is the last stage, right? Changing the wheel is the last thing which you do. When you're around 30,000 kilometers on your tire, you start perceiving small type of punctures here and there. That is the type of pain which you will start perceiving when you start having arthritis. At those moments, what we do is we've got certain solutions to it. In those cases, we have options like the steroidal injections, the PRP injections, or even artificial joint fluid, which can be injected into the joint. But understand that that is not a solution, but a patch fix to get you across a certain period of time, right? But eventually, it will run out and we will have to change the joint. But how do you know when is the time to change that joint, right? We'll talk more about this in my next video. When is the best time to get your knees done? So I hope you got what we were looking for. Here at Aster RV, we've got a huge team which only specializes in joint replacement and arthroplasty. And probably we could give you a better, understanding of your problem, a holistic understanding of your problem when we see you face to face and assess you personally.